Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show. I love that. So let's get started. What's the newest treatment used for pancreatic ductal cancer? I think that's the question. And Dr. Huber, any comment? Are you there?
Sure, yes. There's several treatments that are relatively newer. There's combination chemotherapy with FOLFIRINOX. There's gemcitabine and nab-paclitaxel. There's one called Onivyde. It certainly is an area of research and that it's changing, no doubt.
All right, and in my case, I kind of was on the cutting edge of getting cancer chemo before the surgery, and there's a lot of trend to do that now. Adjuvant means we don't know that it's spread, but we think it is, so we're going to give you chemo. That's called adjuvant, even though it looks like you got it all, quote unquote. Neoadjuvant is give that chemo before the surgery and the radiation to shrink the tumors so the surgery can work better, and then you get the surgery. What's the newest treatment used? Okay, a man from Winter would like to know what tests are recommended for men in their older age who have a family history of prostate cancer if a PSA isn't the most reliable test. Grandfather and father had prostate cancer and passed from it. And my answer is get a yearly rectal exam. I would not get the PSA, but maybe some would get the PSA. You disagree?
This is a topic that I think there's a lot of room for disagreement on. Yeah. My first comment to this individual would be, boy, he's got 2 generations of prostate cancer. Depending on how old those individuals were, it might be worth sitting down and visiting with a geneticist. Mm-hmm. Could there be some kind of a genetic link? Then Dr. Huber may have more to add to that particular point. I think that there's different recommendations from different groups about the PSA test. And one of the big problems with the PSA test is that even though prostate cancer is the number 3 cause of cancer death in men, or is it number 2?
It's close.
It causes a lot of deaths. It causes a lot of deaths. But an awful lot of people get hit by a bus when they're 90 with their prostate cancer. Yeah. So it's a very variable disease.
Right. There's a lot of...
Dr. Holm,
yes.
What age would you recommend? I mean, my grandfather died of prostate cancer, so what age would you recommend that screening study?
Yes, well, and of course there's some argument about the rectal exam, but I can tell you, I'm going to shift to this, that yearly rectal exam, I know there's some argument, but boy, I've caught numbers of cancer just by screening with the yearly rectal exam, feel that prostate, see if it's large or harder. I've caught a bunch of prostate cancers that way. Stool for blood, have caught a number of colon cancers that way. I like that rectal exam. If there's a change in your urine flow, and if you think that there's an abnormal rectal exam, the PSA. If there's a strong family history, some might say still screening PSA. And I think there's a lot of argument either way, and you've just heard some of it. I would say the rectal exam, but not the PSA.
Other people would say the PSA and not the rectal exam.
I know.
So this is one of those situations where I think there's a lot of people of good faith on either side who disagree with each other.
Right.
So bottom line is, this individual should talk with their physician and make that decision
informed
in the larger context of their overall health.
Right.
And Dr. Huber, is there a genetic connection with prostate cancer?
Definitely, for sure. Clearly it runs in families. It's one of the ones that's on the stronger side, like breast cancer, colon cancer, that can really run in families.
A man from Winter would like to know what tests are recommended for men in their older age. Oh, that was it. A woman from Brookings had a mother with multiple myeloma. Is this hereditary? Deb, do you know?
I don't know. Dr. Huber.
This would not have a strong hereditary, but maybe a very soft.
And multiple myeloma is a leukemia of a bone marrow cell, the bone marrow cell that makes antibodies to infection and so on and so forth. Would you explain it any differently?
It's just what you said, Rick. It's the cells that make the antibodies part of your immune system that grow out of control in the bone.
Dr. Rojas, a woman from Brookings asked, how many years do you need to wait to get a pap smear after you've had a hysterectomy? Or do you get a pap smear after hysterectomy?
No, once you've had a hysterectomy, the only way you'll need further follow-up is if the hysterectomy was done for cervix cancer or severe precancer cells. Otherwise, you don't need a pap smear if it's done for non-cancer.
Okay.
However, that doesn't mean that you don't need to go in to see your doctor to get a pelvic exam.
Now, there's some argument about pelvic exam
There is some
frequency.
argument about screening pelvic exams in people with no symptoms. And just like you have the whole, well, I still want to do those rectal exams, I still want to do a pelvic exam because I see things that women are often way too embarrassed to talk about, or they don't have any symptoms, things like lichen sclerosis or hidradenitis suppurativa or other kinds of conditions that maybe aren't going to come up without an exam.
Let's talk about lichen sclerosis. We had a question about lichen sclerosis. What is it, and why does it occur, and what should you do about it?
So lichen sclerosis is a skin condition, and the place that I see it most is in the genitals, but it can certainly strike other areas. And it's a condition where the skin starts thinning and losing its architecture, and in women particularly, which is the most of where I see it, you'll start seeing the vulva, the outer part of the female genitals will kind of start tightening up and closing off, and you see the loss of those inner and outer lips. And one of the big concerns about this is that there's a potential for skin cancer to develop in this area. And there are treatments. Some women don't have any symptoms, and other women have itching or other discomfort associated with it. But the skin condition can be other areas, the mouth.
The mouth.
Yeah,
And the forearms.
mucous membranes.
Yep. Dr. Rojas, would you add anything about lichen sclerosis? That was a really nice summary. Yeah.
That was perfect, Deb. I think it's important for the patients to not neglect that, because just by looking, there may be lesions that can be identified, and that you need a biopsy to determine if there are cancerous component or if lichen sclerosis shifted to cancer.
Right. A man from Beersford was a painter for 40 years, is wondering if his exposure to lead can increase his likeliness for cancer. Mark?
There are some heavy metals associated with bone marrow cancers like leukemias and myelodysplasias. I don't know, not aware of any screening guidelines for people who have had lead exposure, to be honest. I'm not aware of that.
Yeah, I think the major thing is maybe check your lead levels, and the other thing is that because there are neuropathies that can be associated with lead exposure and chronic lead levels being too high. Anything you can add on
Well,
that?
I always think about children when I think about lead
Lead.
more than I think about adults.
Yeah,
So.
but you know, children grow up to be adults.
They
Adults
do.
matter too, you know.
If you say so.
A woman from Rapid City of 2017 was operated on a retroperitoneal liposarcoma, and the procedure took 7.5 hours because it had spread into her spine. If this reoccurs, will it likely be in the same area or in another area of the body? Dr. Rojas, that sounds like your territory. Retroperitoneal meaning behind the peritoneum but in the abdomen. Liposarcoma meaning a cancer-like growth of the fat tissue. What would you say more about this?
I would say that, it can come back in the same spot. And with those cancers, surgery is the most important thing. If you remove them and cannot remove it with healthy tissue around it, or leave a little bit of it, it can come back for sure. So it gotta have some follow-up of that for sure.
And I'm sure, even though it was spread into her spine, I think they probably did their best to get as much as they could get and hopefully got it all. That's the hope.
Indeed.
A woman from Carroll, South Dakota. I've never heard of Carroll, South Dakota. Have you?
I have not.
Have you guys heard of Carroll, South Dakota? Never.
Carroll, Iowa, but not Carroll, South
Carroll, Iowa.
Look, you are being watched in places you didn't even know.
How about that? Carroll, South Dakota or Carroll, Iowa. What would cause a mottled liver? Would it be caused from high cholesterol or something else? Now, how would you know you have a mottled liver for one question? I would say maybe it's cirrhosis on a CAT scan.
What I actually think of on those circumstances is fatty infiltration of the liver, which is certainly far more common. Certainly cancer can occur in or spread to the liver, but I wouldn't expect that necessarily to be described as mottled. That sounds like a description that somebody saw on imaging, on either an ultrasound or a CAT scan. And, so there's a lot of things that could cause that, and it probably needs to be looked into.
Yeah, although I can remember J. Willis Hurst, my teacher and mentor and the head of the Department of Internal Medicine at Emory University, had a CAT scan or an ultrasound, and they found lesions on the liver. He told everybody he was dying of cancer, and he died 20 years later of heart failure. It wasn't cancer of the liver. And so modeled, findings on by radiologists, we love to have those reports and we make a clinical decision, but this sounds like nothing pertinent. Would either of you in Sioux Falls suggest that we do anything with a modeled liver?
The first thought I had was what Dr. Johnson said, fatty liver, like off an ultrasound report, is kind of reading between the lines what this sounds like. So that's what I was thinking.
And fatty liver is important because if it, in a certain percentage, can go on to cause cirrhosis and scarring and liver failure. So it's not something that should be ignored, and cancer if you get cirrhosis. So a lot of times that's associated with diabetes or with obesity. It can be associated with alcohol, but it is probably not cancer. It could be, depending, but it certainly needs to be watched.
Yes, it does.
Investigated.
Well, I think that does it for tonight, folks. Thank you. Thank you. Let's go around the horn. Take home message, Deb.
Keep up with your screenings. Go in, get your annual checkup to make sure that you're keeping up with your screenings, that your immunizations are up to date, that your screening is up to date.
Mark, take home message.
Stay tuned. Things are changing fairly quickly. 5 years from now, we could do this show and have a totally different conversation.
Okay. Luis, any comments?
My comments is listen to your body. Sometimes there are very subtle changes that your body's giving you for something wrong that can lead you to, prevent a
problem. And my take home would be that the careful history and physical exam by your clinician and or doctor or nurse practitioner or PA is very important. That history and that exam, not the expensive tests so much, although we have to take everything into consideration. Thank you for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. So until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.